things that I think came up time and time again during the sort of questioning that we were having prior in our sort of reach out was really with respect to, like you're saying, about the facial downward migration over time. And I think part of that is because of if you imagine the aging process affects muscle, it affects skin, it affects bone, it affects fat. And what we find is that the main things that people are concerned about is the downward migration. Okay. Now we've already spoken about estrogen affecting bone density, and part of that will cause an acceleration in bony loss as you transcend through from perimenopause right through to postmenopause for up to the first 4 years. And the majority of the changes that occur are in really specific points in the face, and those are points around here, in the bone next to the nostrils, around the eyes, which makes the eyes look a little bit more sunken and hollow. It affects the bone structure here, right at the corners of the mouth. So often people will get this little sort of downward migration and jowling at the corner of the mouth that you see here. And you also get these lines that you see going from the nose right down to the corner of the mouth. And that can happen even very early on in an adult life as you have bony changes, because the bony remodeling occurs all the time. And if you think about the face as being a coat hanger, it is the structure that everything else is formed upon. So of course, when you have this loss of the structure of that coat hanger, what will happen is the tissues no longer have anything to form on. And you'll get this downward migration. You also get fat atrophy, and you might be able to give a little bit more information about the estrogen side of things with fat. But there is definitely fat atrophy, which basically means the fat starts to get a little bit destroyed and dies away. So you lose fat pads inside the face, and they lose that's the loss of the apple cheeks that you see. You also get degraded muscle function and muscle density. So things just aren't as plump as they were when we were in our early 20s. The skin itself, you can have lots of changes within the skin. Estrogen causes changes to the blood flow around the skin, which also impacts the hydration levels, and you lose something called hyaluronic acid, which is basically a product which is within the skin tissue, and it helps with the hydration and plumpness of the skin as well. You also lose collagen, and that can cause further laxity within the skin itself. So there's lots of different interactive changes, and I think, you know, estrogen is one of them, but estrogen has a big factor on the development and generation of so many tissues, and I think this is why, you know, it's important to be able to think: are those levels optimized? Are we doing everything we should be doing? Is there any other way that we can help to sort of manage ourselves on a more holistic level to make sure that everything is where it should be and that all of our cells are optimized where possible?
So apart from HRT, which I can talk about a bit later, and things like looking after yourself and exercise and diet and things, is there anything that you can do, as in Dr. Melissa, in order to help us prevent the downward slide of our faces?
The inevitable downward slide. Yeah. Yes, I mean, I try to. I'm very much a fan of doing the bare minimum, okay, and doing the minimum that people need, and really starting with managing yourself. So what are you doing in terms of your diet? Are you having a healthy diet, lots of vegetables, lots of fruit? Is it balanced?
Is there any one thing in particular that you should focus on, or anything that is particularly good for skin?
Well, in terms of skin structure, vitamin C is a great antioxidant. So you can apply vitamin C products to your face, and there's lots of products out there. And if people want to go through those things, then we can, it's best to do this discussed in a consultation so that we can give tailored advice for an individual. Vitamin C topically works really well to even out skin tone. It helps with free radicals, which can cause damage to the tissues, and it helps to give an overall sort of nice, smooth appearance to the skin. Helps with skin recovery. There are collagen peptide products which you can take, which you can orally, and those can come in the form of a drink or tablet forms. There's so many things on the market, but several of the drink products are thought to have better bioavailability, so the uptake in your body, so more is available to do the job that it needs to do, and those will help to prevent the breakdown of collagen over time, and help to restore the collagen levels that are there in your tissues, which will help to improve both the skin integrity and the skin laxity and the support structure. So it helps to stop that decline that you get with the collagen levels over time. There are products such as omega-3 and omega-6, which you can have again in tablet form, or you can find in combined drinks, which help with the skin structure. They provide essential fatty acids to the skin. And there's lots and lots of bits and pieces which can help to support the structure and the development. And really, one of the essential things is maintaining your hydration levels as well, because you can do all of these things, but if you're not drinking enough fluids, removing toxins from your body, and clear fluids, water, not teas and coffees as you're drinking there, I can say. Then these are all things which will help to improve the skin. And I'm also a firm believer on maintaining and managing stress levels, because the impact of stress on your skin, I think, is underrepresented, and we all know that in times of stress, we wake up in the morning when we've got that important interview or video, and our skin is not done us the best of favours, and we have breakouts of spots, and some people have troubled more with that than others, and we do need to do a little separate conversation about acne and changes to the skin, because I think there's a whole other topic which we need to go through. But the impact of stress on the skin can be quite profound, and it can cause some people some big problems. So managing that, looking at meditation to help reduce stress levels, can reduce what we call a post-inflammatory response, which is basically inflammation that can worsen pigment problems within the skin. So, these are all things which women going through all areas of life can adopt to help to support them. And I think a lot of your ladies may also complain of pigment changes around here, perhaps, pigment changes here, due to probably changes in the hormonal levels as well, which they just accept and they think is just, it's one of those things, I'm getting older. But actually there are things that we can do with skincare products. There's a massive range now of skincare products and things that can help support people to get much better conditioning of their skin. Sorry, you're about to say something.
No, so I was just going to say, so in terms of kind of skin impact and how we can improve skin quality at the menopause. So there's HRT. There's kind of, it's a three prong, isn't it? There's HRT. There is lifestyle, which seems to have, so managing stress, managing intake, reducing alcohol and exercise, and not smoking and stuff. And the third prong is the skin products and treatments. And I guess it's
it depends on it depends on kind of how far you want to go with it, and the severity of your issues. But I think early management of stuff will help to prevent rapid deterioration down the line. So if you're looking at the lifestyle and the basic things in terms of diet, hydration, all of those things, and then you're thinking, okay, what can I do with skincare? There are plenty of products with, so for example, retinols and exfoliants, and these are all products which can help to improve the skin quality and promote skin health. And I think,
and there's a cream, it's something that you put on your face, a retinol.
These are things that you would add topically. There are some treatments if you have sort of acne problems and things that you might take orally, but those would be probably best discussed with a dermatologist, and we would do a consultation with people and recommend if we thought that it was out of our area of expertise, we would refer them on. But there are a lot of over-the-counter retinols, but there are also a lot of medical grade ones. So I think the best thing to do would not really be to dabble this stuff. Really, if you want an effective treatment, just have a consultation. We offer free online consultations for people, and we can do video consults, so we can have a look at what their skin's doing, or they can send us images.
How does it work? What would people expect to see in terms of improvement?
The retinols are tricky ones because they can cause a lot of increased skin sensitivity, so they have to be used with care, particularly the medical grade, but they will help to the skin to regenerate, and they will help to provide a smooth appearance and help to repair the tissues, so that all the new skin cells that are coming through, you have a nice even tone. It can help with, along with other products, to improve the overall appearance of the skin.